So this is Men's Health Part 2, Dr. Damas. We're
Yeah.
talking prostate health, erectile dysfunction, and how to hook a brother up, as you have in your subtitle, which I thought was adorable. So talk to us. What do we need to know about prostate health? What do we need to know about erectile dysfunction other than what we already know? And
Mhm.
what in the world can CBD and cannabis do, if anything, to help impact the health in all of those areas?
Yeah. So last show, we discussed that it was Men's Health Month, and we had a
Right.
whole rundown of things that we were discussing. And we had gotten towards the end, and we didn't really finish touching upon the prostate health and the erectile dysfunction. And next thing you know, the office is getting flooded with calls like, talk about this prostate stuff, but it's not just the men. Actually, it was the women in their lives, their partners
Oh,
calling.
wow.
Yeah, man, it's good stuff. So shouts out to all the wives, girlfriends, partners looking out for their man. So they
And
call their off,
boyfriends, and
and
boyfriends,
boyfriends.
and
Yeah.
non-binary spouse and
Yeah,
friend relations, and I don't have a generic term for that. All the lovers. Shout out to
yeah,
all the lovers.
love it. All the people that spreading love. So I was like, yo, we should do part two of this, because when you finished the last show, you were like, hey man, we got to do a part two. So um let's dive a little bit deeper into these two specific topics because they're intertwined. And there are, again, I always give you the information as it pertains to us, our subset. So we're going to hook the brothers up, I myself being a brother with the fine Corinthian skin. So, um, so
Is that the
prostate,
Corinthian leather skin?
the Corinthian.
You know what? Get to the point, sir.
So the prostate. So let's get to the serious thing, right? So we hear a lot about prostate cancer, and again, as usual, when if the world catches like a cough, we get the flu. And
Mm,
so diving into the details, we find out that brothers are at a greater risk for um, developing prostate cancer, and actually have a greater risk of dying from it from other when compared to other populations. So we're looking at African
mm.
American men being about 1.7 times more likely to be diagnosed with prostate cancer, and 2.4 times more likely to die from it, right?
Jesus.
Yeah. And altogether, about 1 in every 8 men are going to have a diagnosis. And so that's
Mm.
like really important right there. So why is it, like, what's going on with us again specifically that puts us at higher risk, right? So a couple
Yeah.
of things. One of the things we talk about is systemic racism. So unfortunately, we talk about it in a lot of other ways in terms of economic opportunities, educational, criminal justice, healthcare. It's a big thing. It's not policies that are just directed towards our healthcare, but it's policies that affect our lives. So there were studies that show that people, for example, that lived in lower environmental quality areas. So that's, the term they use is environmental quality, meaning, lower income, substandard infrastructure, water quality, air quality, those type of things. The same reasons we have higher rates of asthma, same
Mm.
reason that we have higher rates of prostate cancer. And then there,
I take this issue for me. This is a little personal, even though we're laughing and a little unjust in it. My father, when he passed away, prostate cancer was one of the contributing cancers that contributed to his death. And the fact that the rates of detection and a treatment and the rates of death are so high, this feels like we should be screaming this from the mountaintops. There are so many men who are navigating this space, and it seems as though it's just sort of baked into our understanding of what happens at the end of life. And I find that uh, I find that troublesome.
yeah,
I can just say
it
that.
is unfortunate because, like I said, it pops its head, it rears its head in so many different ways as you kind of dig through the numbers, and it's like
Yeah.
they got us again, right? And so, like,
Mhm.
another example of it, again, going to the systemic racism in medicine, and we've talked about this when it pertains to women's issues, is the belief that brothers and sisters, people of color in general, but especially Black people, have higher tolerances to pain. And
Mm.
so the discomfort that
That
they're
again.
feeling and the signs that they're expressing are often not tended to or given the same weight as they do their white counterparts. And so there was a study that in its findings, it said it is generally supposed that Black men accepts physical discomfort, especially that associated with the GU tract, as a natural event in the course of life and would be slower in seeking care than the white man. It's literally in the study, right? So they drew this conclusion.
No, that cannot be. They did not say Dr. Damas.
And in some of the other things,
we need reparations for this, by the way, Mark. This is something else we need reparations for.
Yeah, and then associating, sexual activity with it, so rates of STDs and a whole other things being associated and saying, well, yeah, this is why they're getting it at this rate, and it is what it is. Basically, it's like those people are who they are, and there's something wrong with them. We don't know what's wrong with them, but whatever. And like we always say, and then our problem is kind of dismissed. And so that continues to this day. And so we do get later rates of detection and lower care. And then obviously there's the other part of it. It's our personal experiences, right? So there's a lot of distrust of the kind of like Western medical system because of so many things, right? It's like so many horrible things that we are as a group would be less likely to go to a physician because of the distrust, less likely to participate in any studies because of the things that's been done in the past. Like, we're not dumb. You might think we're dumb, but we ain't dumb.
Right. There goes those perceptions again. We don't care what you think about us.
Right. We're not messing with you like that. We know how you get down. And so, because of that, we have all these things. And so real quick, we're not going to go over like all the screening requirements and all that, but we do have an article as usual. So everyone will be able to find it, but you should get yourself your screenings. It's very, very important. If you're at average risk, 50 years old, 45 for people who are at higher risk, and that means you have other comorbidities, diabetes, high blood pressure, high cholesterol, and all that stuff, or family history as well. So make sure you get your screenings, your PSA, your digital rectal exam. I know that's uncomfortable. It's not something that you're looking for, but it's something we have to do. And then also make sure you understand.
I mean, at least you don't have to get a pap smear every year. I
mean, right? Suck it up, right?
Like,
take it like a man.
We take it like a woman. Shit. Like we the ones that be having to take a pounding. God, let me stop. All right, Lord.
Take it like a man.
Take it like a woman. Take it like a woman. We got to spread. We have to go to the gynecologist every year. Dr. Damas, we had. You know what? I don't. Let me not. I was going to take us down a whole other pathway. We was going to be laughing and kikiing, but we was not going to get to the point. Let me save it for tomorrow. Yeah. But yeah, take it like a woman. Go get it done. Please get it done because it literally can save your life. Discomfort aside, it can save your life. My God.
Correct. And so. And we also have to make sure we differentiate between prostate cancer and BPH, which is an enlargement of the prostate. It's not cancerous, but you can have some similar symptoms, urinary retention, urinary pain. And so, we just got to make sure that we are more vigilant and more active in that. And like, we don't have the bandwidth to be messing around, right? So we literally don't. So we got to be really tight and really kind of mindful and intentional about how we're taking care of ourselves, because for a number of reasons, when we get into one side of the healthcare system, like our prospects diminish a whole lot, right? So you want to make sure you stay out of that side of things way beforehand. So now going on to the CBD part is that we touched on it slightly, how cannabinoids can help with it. So there's some studies that we found in other countries, because we haven't been able to do a lot of research in the US, but they found that cannabinoids, and this is something we've known about cannabis and cancer cells for a long period of time, can help contribute to cellular death or even decrease proliferation. Cellular death meaning that the cancer cells killing themselves, or decreased proliferation, meaning that they're not reproducing themselves at the rate that they normally would. Obviously, this stuff has been done in laboratories and test tubes and things like that. So we haven't had long-term clinical trials on this, right? But we also know that it helps with a number of other things, which is specifically the treatments, side effects of treatments, those type of things, which add a significant amount of morbidity to people, right? The pain, So the pain is a big part of it. Before they used to do these prostatectomy surgeries, which were like out of control, one of the worst surgeries. Now they've gotten better. They'll do something less invasive called the TERP procedure, but that's not without pain. So the reason that, to tie this all together is that we have patients that have come into the office, men who've had prostate surgery, prostate treatments. Some have had the seeds, the radiation seeds, and the pain and discomfort
Wow.
off the chain, right? Like it
Wow.
is off the chain. And so we've been able to help them with suppositories, with CBD suppositories, rectal suppositories, which, these patients, and we've had about 6 of them, um, have been able to use these suppositories, and they decrease the inflammation and pain and cramping as it's healing, and really significantly improve their healing course and their morbidity in the general sense in terms of their quality of life. So this is like big time, because other than that, you're again looking at hardcore narcotics or just taking the regular NSAIDs, which we're not touching them. So that's a big part of it. And then this is another thing which is like very important. We also get these calls on erectile dysfunction, and there's a great overlap between those two things: prostate issues and erectile dysfunction, not only prior to treatment, but post-surgical or post-treatment, radiation, surgical, chemo, any combination. That there's a lot of this that's intertwined with it. And then there's the ED itself that pops his head up. So then we got this thing that people call in the office about, like, hey, can you help me? Can you hook a brother up? I'm still
Well, because
trying
if
to be in
ED
the
is
game.
popping up, the other things ain't. So I would imagine that is a problem. That is a problem. But but I always equate CBD with relaxation. So it's almost a little counterintuitive to me that CBD might also be able to zhuzh up, if you will, one's penile instrument. I've got, y'all, some of y'all got kids in the car, so we can't be as graphic as we'd like to be. But what
Mhm.
can CBD do for someone who's experiencing ED?
Yep. So ED has a number of causes, right? So we're going to start with something that you just mentioned, like you've thought about CBD and anxiety, right? So we're looking at the psychological or psychogenic causes of erectile dysfunction, right? It could be related to other things: depression, PTSD. I always tell people, I personally, I've never done any studies on this or research, and this is outside of my purview. If you grew up Black in America, like I grew up in Flatbush in Brooklyn, there's a certain amount of PTSD that you're going to have. There are things that you saw, experienced. There's a certain amount of, like, dysfunction that you were exposed to, which makes you hyper vigilant. You behave certain ways in public because of that, dreams that you've had. So the idea that you're walking through this existence in this America as a Black person and not leaving with something that you ain't want to start with is slim to none. So when you look at the psychogenic causes of ED, guess who is more susceptible to us?
Gotta
Us,
be
right,
us.
brothers.
Gotta
I'm
be
sorry.
us.
So I'm sorry. I'm sorry to bring the bad news again, but knowing it is really important. That it's the, I always tell people it's not you. So we have for example, a lot of military men who, servicemen and women who come into the office for treatment, and it's really prevalent amongst them. In the women,
Mhm.
sexual arousal disorder, in the men, erectile dysfunction. And it's like this is part and parcel of what happens with your vocation. You went into a pathway in life, and there's high chance that this is one of the things that's going to happen as a result. So it's not like something specifically wrong with you or like your malfunction or whatever. It's
Right.
literally what you've been exposed to and what the environment has created. So these psychological things are really, really important with it. And so the cannabinoids being able to decrease the amount of stress, anxiety, or the effects on your libido from mental health issues, depression, like I mentioned, a big part of that, right? Because you will lose your drive and desire if you're suffering from mental health disorders that are overwhelming your ability to kind of navigate your way around them.
I know that's got to be such a relief for the people that you speak with, for you to just, as a doctor, say it's not you, right? I can imagine the amount of stress and frustration people are carrying by the time they get to your office. So to hear someone be able to say, no, listen, take a step back. You are not the problem. You're in an environment that is contributing to this, but here are some pathways forward. I would imagine that just hearing that is a
Yeah.
source of relief that might help a lot of people take that next step towards their healing journey.
Yeah, because if you look at the way that men tie their sexual function to their self-worth, their value in society, their virulence, their definition of manhood. And so that becomes, a heavy burden. And it's not something that's easily discussed, right? To say,
Right, right.
I'm quote unquote not the man I was at some point and have these
Mm.
discussions. And so, people avoid the discussions or avoid the treatments for it. Or sometimes, again, dealing with the second part, this is not just psychological, but it's also part of greater health issues. So if you've got underlying issues like diabetes, right, your blood sugar is poorly controlled, we're more susceptible to that, to not only having diabetes, but when we do, to being less, less managed, more poorly controlled, right? So that is something specific to us again. So, having those kind of discussions about general health, exercising and diet, because those contribute to it. And it's also why, African American men, we tend to suffer from erectile dysfunction at higher rates because of the combinations of all those things. Psychogenic factors, like, yeah, times is hard out here. Yeah, it's real out here. It is, right? Because you don't, just leave that at work or on the street. That stays with you when you
Right.
get home. Then you have the health issues that we have, societal and systemic reasons that contribute to it, right? And then we have the personal psychological things in terms of acknowledging that you need help and trusting a system to help you, all those things together. And you ain't gonna happen for you. It is not gonna happen to you. And if it does happen for you, sometimes it's not enough for you to finish or to satisfy your partner. And so when we get into the cannabis side of it, it allows you to do a couple of things that some of the medications that you may have don't. Um,
Let's hold it right there. We have a caller on the line. I'd like to hear from this caller, and then if you can just take us right into those benefits that cannabis and CBD can provide. Jim from California, another first-time caller.
Mama made it.
Oh, two great conversations today. But
Thank you, sir.
I just wanted to share something. First of all, reparations. The United States will help rebuild Germany and Japan. And nothing for us.
Yeah.
I'll leave that at that.
Yes, sir.
Secondly, I'm a 79-year-old African American man. I had prostate cancer at 55. I had surgery. I had a great African American urologist who spared both nerves. A colleague or a friend of mine, a surgeon, recommended, because I was so young, to have the surgery, because if I got a recurrence, at least I could have radiation. Because if you have radiation at that time and you get a recurrence, there's nothing left but hormones.
Wow.
So I had two friends to succumb to it because they could not deal with the fact that they might be impotent. And now they're permanently impotent. They're gone. And my life is fine. I mean, it's okay. I mean, at 55, I had a real good time up to 55 and still can. It's not the most important thing in the world. Living in life is what's important. And
Thank you for
you
that,
have
Mr.
to
Jim.
get care from people who care. I'm a dentist, and I talk to all young men. And I talk to my son, African American men in their 30s, at least a PSA regularly.
Thank you for that, Mr. Jim. Really appreciate you calling in to share your experiences. Dr. Damas, when you hear that, we've come a pretty far way from where we were at that time, and yet there's still so much work to be done when it comes to the psychological approach to this particular issue. Talk to us now about the role that cannabis and CBD can play for men and people who are navigating this journey.
So if we tie those two together with the prostate, right? So we talked about the pain and inflammation post-treatment, whether it's surgical, whether it's radiation, right? So that adds a significant amount of morbidity to the disease course because you're suffering a lot. So we've talked about cannabis, CBD being a very potent anti-inflammatory. So it's going to decrease the amount of irritation, your body's reaction to like, hey, something unnatural just happened to me, right? Like there were pieces cut out, so your body's going to react to that. So that helps people significantly with that. Like I said, the suppositories are great. We don't have them on the site yet, but we did put up a guide that people can find. You can do it yourself suppositories at home. So put all the links. If you read the guide, you can click the stuff and, buy a little mold from Amazon and add the CBD oil, make it yourself. And then there's the anxiety. Huh?
That's it. That's fantastic. I'm sure the
Yeah.
guides are very helpful for people. And again, take it like a woman. Men, young girls have to learn how to use tampons and pads at a very early age. You can learn how to insert something into an open portion of your bottom cavity. You will be okay. It doesn't indicate anything about you or your orientation. I know I got to say that because some of y'all a little worried. Some of y'all don't even eat whole bananas because you worried about perceptions and things.
Glizzies, hot dogs. You can't even
eat
a hot dog around these dudes now.
I saw a video of somebody eating a banana sideways. I was like, what?
What's up with
gonna
that?
Kill us. Homophobia is killing us. Lord. But that'll be helpful for people. I'm glad that you'll have that. This is one of the reasons why people love calling your office, because you guys always provide such a helpful information.
Yeah, trying to hook the brothers up. And then also when we talk about the depression, the mood, and those type of things, it helps prepare yourself or prepare your mind to be in the space where you can think about intimacy and not all the other problems that you have in the world, where you can think about intimacy and not the pain that you're in or anything else, right? And then lastly, the two other things that it does. So cannabinoids are known vasodilators. What that means is that they expand your blood vessels a little bit, right? And so if you have someone who has cardiovascular disease, you have stiffened arteries, right? Every little bit helps. Now, it's not going to dilate them the same levels that like your Cialis or Viagra will, right? But it's a nice adjuvant if you've got like lower levels of vascular compromise. It will help dilate it a little bit so it can get yourself, closer to where you want to be in terms of a functioning member to engage in intimate activity. You like the way I talked about that without being... You like that? I sounded like a doctor on that, right?
Yes, and anyone of any age could have heard it, and it was
totally appropriate.
They're not shocked in the morning on the West Coast. I be thinking about y'all early in the morning. You ain't necessarily prepared for all what's going to happen later on in the day. We get it.
Exactly.
Dr. Damas, we have another caller on the line, Barbara in Ohio, another first-time caller.
Hi.
Hi, Barbara. We're at the end of the show, so we only have a minute or two left. What would you like to say this morning?
I want to thank you. I lost my husband to prostate cancer 3 years ago, and he was going for his regular. And this is just like a PSA, I guess. He was going for his regular, just everything, and he missed 1 year. And when he went back, his PSA was up over 500, and it had already metastasized to his skeleton. So please continue to let people know that this is something that should be done every year at least after you're 40. Every year, get the digital, do everything. Do not rely on just the blood test, because I lost my husband of 35 years, and it was not. And he was 69 when he passed. And I used to talk to Mr. Madison too, because he had prostate cancer. And so I understand the pain that is, and that's a very it's not an easy process for a man to go through. And I just want to just encourage people to do it, bend over, get it done, because it can save your life. And do it every year. Don't skip a year. He only skipped 1 year.
Barbara, what's your husband's name?
Leonard.
What is your Leonard? We say his name. We acknowledge him as an ancestor. We send you our heartfelt prayers. My heart to yours can only imagine what it must be to suffer that sort of loss. So thank you for calling, and we're going to keep talking about this issue. Prostate Cancer Awareness Month, I believe, is in September. We're going to keep this issue at the forefront. Joe Madison again, his experience is something that tells all of us how serious of an issue this is. My husband, we're going to be celebrating one of his milestone birthdays this year, and it is becoming clear to me that he and I are now, I'm looking at 40. I'm not 40. I'm looking at 50 in a couple of years. I'm realizing mortality is a real thing. And I cannot imagine. I actually was just getting on him the other day. When's your next appointment? In fact, let me call the doctor to make an appointment because I got to make sure you ain't skipping. So family, friends, those of us who have loved ones who we know are exposed to particular risks just because of age, because of all the qualifying factors that Dr. Damas shared with us, it takes a village. It takes a village, Dr. Damas. So if people were to call your office, please give us the number for them to call. And I will say every Urban View person I've ever spoken to who has called your office has had a phenomenal experience. And this makes me very, very happy. What's the best way for people who have additional questions, who perhaps want to have a more detailed conversation with you, maybe off air? What's the best way for them to reach out to talk with you and get access to your wisdom when it comes to prostate cancer, erectile dysfunction, and overall prostate health?
So you can give us a shout, call the office 833-362-3262, 833-362-3262. You could also go to the website, drdamas.com, drdamas.com, or spell it out if you want, drdamas.com.